Certainly the number one reason why someone would have a knee replacement would be severe osteoarthritis of the knee. But we certainly see patients with other types of arthritis, whether it be a post-traumatic arthritis, whether it be rheumatoid arthritis, psoriatic arthritis, post-infectious arthritis. So there are other reasons why people would have it, but the vast majority, I would say in my practice, 90 to 95% of patients have osteoarthritis, which ultimately leads them to have surgery. What we do encourage is that for the patients to do everything they can conservatively before they have surgery, anywhere from weight loss to physical therapy to anti-inflammatory medications. Cortisone injections do temporize. They don't cure, but they temporize. But when patients get to the point where they don't want to live with the limitations, that's when we would suggest they have surgery. If you have to go home and say, should I do it or should I not do it, you're not ready. One morning you wake up and say, I'm ready to do it, and that's usually when it works well. The technique that I use is called the minimal incision knee replacement surgery. So it's a smaller incision. I would say it's about half the length of what the normal surgery would be. During that surgery, the one thing that I don't do is I don't cut into the quadricep tendon, which is a tendon above the knee. And by not cutting into the tendon, it does enable a little less painful recovery. I think in general a little easier recovery, and most importantly in the long run, better flexibility to the knee. And what we do is basically make a series of small cuts and essentially shave the bone down to accept the knee prostheses, trying to preserve and save as much bone as possible. Certainly 30 years ago, it was a major undertaking with a very long incision, an extended hospital stay. The average length of stay in the hospital in those days for a knee replacement was about 5 days. And then most patients would go off to rehab for anywhere from 1 to 3 weeks. Today, it's to the point where the patients are actually up walking the same day of surgery. Last week, I had 2 patients who went home the next day after the procedure, and actually one of them could have gone home the same day, but I wouldn't allow them to. A much smaller incision. I now use a computer-assisted equipment in the operating room to do very exact and very precise surgery through a much smaller incision. Pain control was always difficult with knee replacements. The patient would actually have a button and they would push the button and give themselves a dose of pain medication. IV narcotics had all kinds of side effects. Patients would get nauseous, they would get constipated. Now we never use that. And recently, in the last year and a half, I've been using an injectable, long-acting Novocaine type medication into the knee as we close the incision, so that the patients don't need to have any IV or IM narcotics. Any pain medication they would need would just be some tablets if they needed it. And because of that, the less pain medication people are taking, the less groggy, and therefore they're able to get up and move around. The other thing that we do now is almost every surgery is done under spinal anesthesia. So the patients in the recovery room are wide awake within minutes after the surgery. And because they don't have the ill effect of the general anesthesia, they're actually, almost everyone is actually walking the day of the operation, which is great. What we do here at Milton now is once the spinal anesthesia has worn off, the therapists are usually with the patient within an hour after the operation. We try to actually have the patients out of bed, have them up walking, have them moving, trying to really sort of get back on their feet and be ready to go home. If you end up going to rehab, very often you have to ask permission to get up and walk. You have to ask permission to get up and go to the bathroom. Whereas if you're home, if you want to go get something to eat, you have to get up and go get it, or if you have to go to the bathroom. So it basically forces you to get up and do more. And there's no question that the more active people stay after the surgery, the quicker the recovery. So I would say that over 95% of people that have knee replacements ultimately get to the point where they're happy they had it done. The full recovery is a process. And I'll tell the patients that when they sort of reach the maximum benefit, when their knee is going to be as good as it's going to be for the rest of their life, it usually takes about 18 to 24 months. Some people look at that as a discouraging thing. Honestly, most people within 8 to 12 weeks are doing very well. What I say to them, you've got a lot to look forward to, and just over time, it just gradually gets better.